Good afternoon, and welcome to the June 4th Community Update. My name is Stacy Wood, and I serve as a Public Information Officer in the Emergency Operations Center. This community update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Today's update will be provided by Dr. Jennifer Mullendor, Buncombe County Medical Director and Interim Health Director.
Good afternoon. Every day brings new challenges and questions for all of us to figure out related to this global pandemic of COVID-19. As our community continues to open back up, we must keep working together to slow spread of the virus. As of noon today, we have investigated 363 lab-confirmed cases of COVID-19 in Buncombe County residents. Since then, we have continued to receive additional reports of cases, which we are actively investigating. When these are added to our data dashboard, it will bring us into alignment with the 374 cases reported in our county on the state website. Sadly, 30 Buncombe County residents have died from COVID-19, including 25 residents of long-term care facilities. 80 cases, or 22% of the 363 cases in our county, are in Black, Indigenous, or people of color, who make up 8.4% of the county's population. Additionally, almost 90 individuals, or 25% of those with lab-confirmed COVID in Buncombe County, identify as Hispanic or Latinx, a population that makes up 6.7% of the county's population. As I've mentioned before, this uneven impact of COVID-19 illness on Black, Indigenous, and people of color in our county, compared with a white population, also is being seen across the state and country, where it is additionally showing up as a disproportionate number of hospitalizations and deaths. Structural racism and the inequities it leads to in housing, employment, income, education, and other social determinants of health result in these worse health outcomes. Recognize that we have targeted testing in these communities, acknowledging that these populations are disproportionately represented in our service sector, and they don't have the privilege in their work settings or have access to employment opportunities that enable the use of teleworking. Let us all remember that in our day-to-day, every contact counts. An easy step we can all take to do our part in addressing these health inequities is remembering to follow the 3 W's, which includes wearing a mask when we are in all public settings in close contact with others. We are in a global pandemic, and people are dying and getting sick. And some people are asymptomatic and do not know that they have the illness. While we still don't know the reason for this, it is important to know that if you are asked by a public health communicable disease nurse to isolate or quarantine, it is important that you take it seriously and follow their guidance right away. Isolation is for individuals who are symptomatic, sick with the illness. It keeps infected people away from healthy individuals to prevent COVID-19 from spreading. Quarantine means that you were exposed to someone with COVID-19 and could be incubating the illness and could eventually come down with it yourself. We want you to stay away if we ask you to quarantine. We want you to stay away from others so that you don't spread infection if you do end up becoming infectious. We are concerned that some people are not taking our guidance seriously, and we want to make sure that you understand it is extremely important that if you have COVID-19 or if you were exposed to an individual with lab-confirmed COVID-19, that you follow our guidance and stay away from others to prevent spread of illness. Buncombe County has resources for individuals who need to isolate or quarantine and cannot do so safely in their current place of residence. A Buncombe County communicable disease nurse can connect you to those resources if needed. Amidst a lot of uncertainty, it is important to focus on the essentials during COVID-19, such as washing your hands frequently and for at least 20 seconds each time, staying home when you are sick, wearing a face covering when you are out in public, and continuing to limit your physical contact with others outside your immediate household to reduce chances of infection. Remember that physical distancing and other measures to slow the spread of COVID-19 are not all or nothing. Even if you choose to go out, it's just as important to remember to try to stay home as much as possible. Please continue to safely interact as a consumer and a community member to slow the spread of COVID-19. With regards to long-term care facilities, we are working closely with those in our county, and we have shared the CDC's recommendation for baseline testing of all nursing home residents and healthcare personnel. We agree and want facilities to do this testing. What we are seeing is that many of these facilities are trying and continuing to make efforts to regularly test all staff and residents based on this guidance. But unfortunately, for some of these facilities, they're running into barriers, such as insurance providers who are not covering the cost of testing for their staff. This is a significant barrier to keeping this high priority population safe through this pandemic. And we have reached out to the state and are working to try to overcome these barriers. Long-term care facilities and congregate care facilities can reach out to Buncombe County if they need additional guidance or support in their COVID-19 response. Administrators at those facilities can email the Congregate Care Ready team at congregatecare@buncombecounty.org. We want to ask employers to encourage their employees to stay home if they are sick, to wear a face covering, and to get tested if COVID-19 is suspected. Please communicate to your workforce that COVID-19 is serious, and keeping COVID-19 from spreading is important. It is critical that individuals stay home if they are sick. We are here to support you as you support a healthy workforce. Putting people first in this pandemic is our priority, and the ability to test and perform contact tracing are critical to keeping people safe. Buncombe County and Western North Carolina Community Health Services continue to provide COVID-19 testing throughout the community. Anyone who has been in contact with someone with COVID-19 should be tested, as well as anybody who has symptoms of COVID-19. For those who have had and have been identified as a close contact of someone with COVID-19, the guidance on when to get tested is that you should do so at least 6 days after your last exposure to the individual with a case. However, if you develop even mild symptoms, such as a cough, a tickle in your throat, congestion, or runny nose, you should contact your healthcare provider for help evaluating those symptoms and request testing as a close contact of an individual with COVID-19. Testing is available at our community testing sites, which should be occurring right now in Barnardsville at the Big Ivy Community Center. Next week, testing will continue to be available. On Tuesday, from 1 to 4 p.m., we'll be at Rock Hill Church in the Shiloh community. Wednesday, from 1 to 4, be in the parking lot of Spake Real Estate in South Asheville off of Hendersonville Road. and Thursday from 1 to 4 p.m. at ABCCM in the Hominy Valley community. Please bring an insurance card if you have one. Language services will be available at all of these sites. Through the end of Tuesday of this week, we've seen over 350 people tested at these community testing sites and have identified 9 individuals with lab-confirmed COVID-19. Many results are still pending from testing this week. Thank you to all the communities and neighborhoods and organizers who have hosted a COVID-19 testing site. Your support is yet another sign that our community is a caring place and that we are showing up in ways that matter. This is an extremely difficult time for many and may place a particular burden, as mentioned before, on individuals of color in our community. Tending to the emotional and mental health needs of your community and yourself are an important part of public health, especially now. Witnessing this trauma repeatedly affects mental health, especially for communities of color. Please check up on your friends, family, and community, as well as checking in with yourself. Have a good day and stay safe.
So we wanted to let the community know that the data dashboard on the Buncombe County webpage is now available in Spanish and Russian. So check out the local data in Buncombe County at buncombeready.org. The Buncombe County COVID-19 response includes widespread testing, food for families who are impacted by this pandemic, and vital public health and emergency services that help to keep our residents safe. Census funds help to support these services. Schools, fire departments, and community centers, and public supports that we all rely on are supported in part by census funding. In short, if you live in Buncombe County, you benefit from census-funded services. So please take a moment to fill out the census if you haven't already. You can do this online at www.2020census.gov. We will provide the next community update on Monday, June 8th at 2:30 p.m. Until then, stay safe, Buncombe.